How is trauma-informed communication used in the workplace? Have you ever wondered how communication can shape a workplace, especially for those who have experienced trauma? Trauma-informed communication is a thoughtful approach that recognizes the effects of trauma, including post-traumatic stress disorder, on employees. It integrates understanding, respect, and support into every interaction. This method aims to create a safe environment that minimizes the risk of re-traumatization and promotes psychological safety. One key aspect of trauma-informed communication is confidentiality and privacy. It is crucial to maintain strict confidentiality regarding an employee's trauma history or PTSD diagnosis. This protects their privacy and builds trust, allowing employees to feel safe when disclosing their needs without fear of stigma or discrimination. Another important element is using non-stigmatizing, person-first language. This means avoiding labels that define employees by their trauma or diagnosis. Instead, respectful language should be used. For example, saying employee experiencing PTSD rather than PTSD employee helps to acknowledge the individual beyond their condition. Awareness of triggers and symptom variability is also essential. Trauma-informed communication recognizes that certain topics or environments can trigger PTSD symptoms. It understands that symptoms can change over time, so communication and accommodations should be flexible and adaptable. Providing choice, flexibility, and autonomy empowers employees. Allowing them options regarding their work and communication fosters safety and trust. For instance, letting employees opt out of certain meetings or choose how they receive information respects their boundaries and reduces stress. Supportive scheduling and interaction are vital as well. Communication about work schedules should consider trauma-related needs. This might mean avoiding assignments or shifts that could trigger symptoms. Clear and compassionate dialogue about accommodations helps employees manage their workload without feeling singled out or penalized. A strengths-based and positive focus is another aspect of trauma-informed communication. This approach emphasizes recognizing and building on employees' strengths and resilience rather than solely focusing on challenges. This helps foster engagement, motivation, and a positive workplace culture. Lastly, effective trauma-informed communication requires training at all levels of the organization. From leadership to frontline staff, everyone should receive training on trauma awareness and communication strategies. This builds a culture of care, respect, and psychological safety that benefits everyone. In practice, trauma-informed communication supports employees with PTSD by reducing misunderstandings, minimizing re-traumatization, and promoting well-being and productivity. It aligns with legal protections such as the Americans with Disabilities Act, which mandates reasonable accommodations for disabilities, including PTSD. By embedding trauma-informed communication into workplace policies and daily interactions, organizations create environments where employees feel seen, heard, and supported. This ultimately enhances overall organizational health and effectiveness.